He's taking on the food industry, the agriculture industry, and the chemical industry. And these are three very, very powerful industries with enormous lobbying apparatuses.
With growing consumer demand for healthier options and new federal nutrition guidelines expected this summer, it's keeping leaders in the food and beverage industry on their toes. Today on 𝗟𝗲𝘁 Spotlight, our guest, noted nutrition expert and author Dr. Marion Nestle, breaks down what these changes may mean for your brand and the future of the industry. Dr. Nestle, welcome to the show. Thanks for joining me.
Oh, glad to be here.
It is such an honor. Want to get started on the conversation right away. So, you are a nutrition expert, Dr. Nestle. Tell us, first off, kind of a broad question, what are your thoughts on where we are with the state of nutrition in this country? Do Americans know what it means to eat healthy? What are your thoughts on this?
Well, we're in a very unusual time in American history because for the first time in ages and ages, we have a Secretary of Health and Human Services who seems really concerned about the health of Americans. Whether he can do anything about it or not is another matter, but it's certainly come to national attention, and it's certainly a matter of enormous press attention, particularly the health of children. The government has just come out with the Make America Healthy Again Commission report on the health of America's children. It paints a very sad picture of the health of American children, not only because of what they eat, but also because of cell phones and other and chemicals in the food supply and other kinds of things like that. And the big question is, what is the government planning to do about it? We won't know that for a couple of months.
Exactly. I was just going to talk about our Health and Human Services Secretary Robert F. Kennedy Jr. As well. He's been making, as you've mentioned, a lot of big waves in the media, most recently being quoted as saying he wants to make big dramatic changes to school lunches, changing those dietary guidelines by the end of the summer. Pretty big move. As I've read, these are changed, once every few years. He wants it done by the end of the summer or in the beginning of fall. Dr. Nestle, what are your thoughts on this in particular? Do you think that's A, possible, and B, will it actually help further, the goal of making America, healthier?
Well, what's interesting about it is that he's the Secretary of Health and Human Services. School lunches are the province of the Department of Agriculture, and the dietary guidelines are a joint project of Health and Human Services and Agriculture. So he's going to have to work very closely with the Secretary of Agriculture about this. And that means if he really wants to make the kinds of changes that he's talking about, he's going to have to take on the food industry. Because if he wants ultra-processed foods out of schools, which is what he says, and if he wants chemicals out of the food supply, he's taking on the food industry, the agriculture industry, and the chemical industry. And these are three very, very powerful industries with enormous lobbying apparatuses that in the past have been very successful in making sure that nobody cuts into their profits.
Dr. Nestle, do you think it's possible to make, headway with these kinds of companies? As you've rightfully said, they're pretty dominating. A lot of the companies have a lot of influence, right? A lot of lobbying power, but we are seeing changes happening. There's more of a spotlight on ultra processed foods. The public has expressed their displeasure with it. You see food activism, 𝗂𝗏𝘂𝗃 𝗂𝗏𝘁, the food babe, really rallying, against companies like Kellogg putting food dyes, in American cereals. And you do see now, companies rolling back on using certain dyes. I mean, do you think it's possible to take on, companies, as the way that RFK, wants to? Is that possible? What are your thoughts?
Well, I think the food dyes are a no-brainer. People have been calling for getting rid of the artificial food dyes for decades, and the companies have at various times promised to get rid of them. They're not necessary. They add no nutritional value or food safety factor to the food. They're strictly cosmetic, and in countries that don't allow them, they've found substitutes. So they could find substitutes in the United States too. They just don't want to, because it turns out that colors are what sells foods to kids. And when they dampen down the colors and they're not as vivid. Kids don't want them as much. They think they don't taste as good, even though there's no difference in taste at all. Ultra processed foods are another matter. If the companies are this resistant to dealing with color additives, what are they going to do about ultra processed foods, which are among the most profitable foods that they make?
Taking a step back here, kind of looking at, wanting to hear your thoughts, Dr. Nestle, what you think the role of government should be and what responsibility do consumers have when it comes to nutrition, in America, for example. Taking the recent news item of food stamps, of the SNAP program, multiple states and more are trying to follow suit in rolling back the eligibility of things like candy, energy drinks, sodas, using food stamps to pay for these items. It's now no longer allowed to use food stamps to buy these things in Indiana and Nebraska. And more states are, again, as I said before, they're following suit. Dr. Nestle, what do you think of governmental efforts like this? What role do you think, government should have in, really trying to educate, trying to, really make Americans healthier versus, empowering consumers to make the choices on their own to be healthier?
Well, when I was on the Dietary Guidelines Advisory Committee for the 1995 Dietary Guidelines, we were instructed by the Secretaries of Health and Human Services and Agriculture to give the best advice we possibly could to the American public, because nutrition is confusing and it's government's role to try to promote a healthier population. I still think that's true. That makes sense to me. The SNAP issue is a complicated one with a very long history. In 1964, when food stamps were first passed by Congress, the original proposal was to keep sugar-sweetened beverages out. And you couldn't use food stamps to buy sugar-sweetened beverages because they were sugars and water and nothing else. And there was already evidence that they weren't particularly good for human health. The soda industry and the retail industry lobbied furiously to keep sugar-sweetened beverages in, because they're a big chunk of what SNAP recipients spend their federal dollars on. And so they stayed in. But the WIC program, the Women, Infants, and Children's program, which is a much smaller program, only allows purchases of healthy foods with the federal benefits. And somehow that works just fine. And there's lots of evidence that women and children who participate in the WIC program are healthier. So I'm not opposed to taking sugar-sweetened beverages out of what people can buy with their SNAP dollars. They can still spend their own money on sugar-sweetened beverages. But what SNAP recipients have told me is that having the electronic benefits able to be used on sugar-sweetened beverages is an incentive to buy them. That if they had to buy them with their own money, they wouldn't buy as many of them, and they would actually welcome the change.
And finally, definitely want to hear what you have to say about your new book, or shall I say booklet, coming out. It's called The Fish Counter, right? It's coming out later in the month of June. Can you please tell us more about that?
Sure. I've got two books coming out this year. The first is The Fish Counter, which is 5 chapters from the book that's coming out later this year, which is a new edition of What to Eat, retitled What to Eat Now. It'll be out in November. The book that's coming out on June 10th is the fish chapters from that book. It's called The Fish Counter, and it's a discussion of food issues related to fish. I think the fish counter is the Wild West of supermarkets, because it's so hard to know what's going on there. And there are so few fish sellers who seem to be on top of what is being sold there. And so the book, which is very short, it's under 100 pages, goes through what the issues are that you need to think about when you buy fish. And these range from mercury in fish, to PCBs, to fish farming, to what happens on fishing vessels, to sustainability and all kinds of other issues. These issues are enormously complicated, and I tried to cover them as fairly as I could.
It sounds like it's going to be a really good read. Noted nutritionist and author, Dr. Marion Nestle. Doctor, thank you so much for joining us once again.
My pleasure.
And that wraps up this episode of 𝗂𝗚𝘁 Spotlight. I'm your host, Susan Choi. Don't forget, for more of our great content, just click on this playlist. Till next time, take care.